Dr. Robert Baluch, a board-certified OBGYN physician with over 30 years of clinical experience. And this video is a little different for our series on birth control, on contraception, preventing pregnancy, and this is on the pull-out method. Now, perhaps this is a little bit tongue-in-cheek, a little bit of a joke, but seriously, I want to make a few comments and tell you what my experience has been over the years so that you can make some good decisions on whether or not you do that. There are plenty of people who use this method and to some success. However, we have a saying amongst physicians on what do we call people who use the pull-out method. No, it's not that. It's parents. So basically, if you use that method, eventually you'll be a parent. If you're cool with that, that's okay. You might wonder, how is it possible? Well, over time, complacency sets in. If you try to add timing to that, that helps as well. But the biggest issue is that before a man ejaculates, the Olympic swimmers, the best sperm, the ones who have the most capability, can sneak out and get away. So even if it's executed properly, you can still get pregnant. The other thing is, if you couple the timing of your menstrual cycle, like using temperature charts or using an app that tells you when you're most fertile, that helps. In fact, using that aside, that helps, adds to its effectiveness. However, what happens is, over years of effectiveness, you start to believe in its really excellent ability to prevent pregnancy, and as you get in your later 30s, you get some irregularity in your cycle, and you can get an unexpected ovulation. And I have many babies on my board from women who've used that method, and a lot of them who've used it for years with success, and then in their late 30s or even early 40s get a surprise whoopsie. So there are other methods that you can use. There is some effectiveness to it, but I would estimate that the longer you use it, the more likely you will eventually be a parent. If that's okay with you, that's great. But I thought you should know a few little points of my experience on how many, probably 200, 300 babies I've had of women who've used that method. I hope you found this interesting and maybe a little bit useful. Thank you.